Welcome to Genomic Matters. Genomic medicine has the potential to revolutionise healthcare and personalised care, but it also raises important questions about ethics and equality. Genomics is the field of science that focuses on the study of an organism's full set of DNA, including its genes and their functions. It involves analysing the structure, function, and interactions of the complete set of genetic material to understand how it influences traits like height, weight, development, and health. Healthcare professionals need to be able to translate and communicate genetic and genomic information to their patients with an understanding of associated ethical issues. The increased availability of genetic information provides a challenge in relation to understanding ethical issues, which include informed decision-making, informed consent, whilst maintaining privacy and confidentiality of genetic information. Genetic testing, genetic and genomic research are also considerations, as well as preventing genetic discrimination and health inequalities. In this podcast, we aim to explore this topic, and I'm delighted to welcome Mark Dronsfield, Dr. Tara Clancy, and Manaza Chowdhury to this episode. Hi and welcome everybody. Thanks for joining me today. So let's start with the first question. What are some of the key ethical considerations in the field of genomic medicine, especially in the context of the UK's healthcare system? What does ethics mean? Tara, if I could come to you first, please.
I guess if I start with what does ethics mean, I think there are probably many answers to this, and it possibly depends on who you ask. I guess my perspective, it's about us as individuals, both within our family and friendship and social networks, and within organisations or institutions where we work within or we're part of. And I think about it's a key part of being human from my perspective, and thinking about what sort of impact we have on other people and our responsibilities towards others. So that includes people that we know and meet. So again, thinking about friend and family networks and colleagues, or thinking about genomics, genetics, and thinking about patients as well, but also about people we don't know and will never meet. So it's about sort of local, national, and global issues, I think. And for me, I think what's key is to think about what values we think might be important, such as respect, being trustworthy, fair and caring. And all of those are important for us to be the best that we can be as individuals and as professionals, I think.
Thanks, Tara. Mark, sort of bring you in at this point. From your perspective, how important is increased awareness of genomics and genomic medicine within patients and public, from the perspective of informed consent, let's say, and ethical practice within genomics as a whole?
Thanks, Barbara. Genomic data is highly personal, and it really is what makes you. So we need to assure patients of the security and privacy of their data. Within underserved communities, there are real concerns in relation to genomic medicine and genetic discrimination. Ensuring that patients are protected from discrimination based on their genetic information is a fundamental ethical consideration. So input from the public is particularly important, especially in relation to research professionals. Professionals need to share their knowledge with patients and the public, as it will direct and inform future projects in support of identified need and unmet need. Genomic medicine should be accessible to all, regardless of socio-economic status, race, or location. Ensuring equitable access to these services is essential to prevent further health disparities, and this includes involvement with research and clinical trials. A strong ethical framework is essential to harness the potential of genomic medicine while safeguarding the rights and well-being of patients and the public. Ensuring that individuals have access to genetic counselling is important. Genetic counsellors can help patients understand the results of genetic tests and make informed decisions about their healthcare.
Thanks, Mark. Yes, I think that really underpins the fact of that informed consent is so key, isn't it? Manaza, if we can bring you in at this point too, please. How can genomics and genomic medicine address those health disparities and promote equitable access to genomic medicine?
Thank you, Barbara. In relation to reducing health inequalities, genomic medicine has the potential to contribute to the reduction of health inequalities in several ways. So precision medicine is a phrase that's becoming more prevalent. And what does it really mean for patients? The phrase describes how genomic information allows for more personalised and precise medical treatments. From a clearer understanding of an individual's genetic makeup, medical interventions can be tailored to their needs, including improving the effectiveness of some treatments. Genetic variations can influence how individuals respond to medications. So understanding these variations through genomics can help healthcare providers prescribe drugs that are more likely to be effective and well tolerated for individuals or populations. This approach can enhance treatment success rates and reduce adverse effects, particularly in groups who have genetic profiles. This approach can potentially lead to better outcomes, in particular for diverse populations, addressing the unique genetic factors that may contribute to health disparities. Genomic tools enable the identification of genetic markers and those associated with the increased risk for certain diseases. This information can be used for earlier detection and prevention strategies, so allowing individuals at higher risks to receive targeted interventions before a disease progresses. So by focusing on preventative measures, genomic medicine can help address disparities in disease burden among different populations.
That's great. Thanks, Manaza. Thank you. And as I say, obviously, all the work that you've been doing on the genes and health study across the Northwest has really been sort of helped to support that, hasn't it? Tara, if we can come back to you, how can disparities be reduced or further reduced amongst underrepresented groups?
I don't think it's easy. I think it needs to be done. I don't think it's easy. I think what both of you were saying in terms of, I guess think about precision medicine for one thing. Personally, I think it's a bit of a challenging term. I think there is a risk of over-promising and maybe not under-delivering. I think that the part of the problem is that papers that have been published very recently have shown that although people of European descent, I mean, it's quite interesting, some of these terms, what does it mean to be of European descent is an interesting question in itself. But most research data, most genomic research data is from people of European ancestry, whereas individuals of that descent account for only about 16% of the global population. And studies that include underrepresented group, and particularly ethnic minority groups, is either not included or disregarded due to low statistical power. And part of the problem then, at least globally, but I think also nationally, is that genomic and other biomedical research is informed by and benefits really quite a small proportion of the global population. And I think another difficulty is that there's a lack of diversity in the workforce, and that can then perpetuate lack of underrepresented groups and communities and research studies. And it can also, I think, at least got the potential to bias the research questions that we ask and the methods that we use. And that can affect results and potential applicability of the research across diverse populations. So I realise that might sound rather gloomy, but I guess I think it's important, I guess, to acknowledge the difficult situation that we're in currently, as well as, you know, think about what steps could we make to improve things. And I think one of the biggest is about being and proving trustworthiness. I think is probably one of the biggest things, and I don't think it's necessarily an easy thing to do by any means. But I guess that would be another thing I think is really important for us to do, you know, both as individuals and as organisations, and I guess in this context as the people within the GMSA.
Thanks, Tara. No, say all sort of vital considerations to take, and obviously with regard to the sort of current availability of data from those underrepresented groups. A question for everybody in turn now, please. How can healthcare professionals support patients to become more informed, to ask for an advocate to act as an advocate for their and potentially their children's healthcare needs? If I can come to you, Manaza.
Thank you, Barbara. I think one of the driving factors in this it's really about education and raising the awareness around genomic medicine, and working across partnerships as well, and collaborations is very, very important. But to be working with patients and communities on the ground, and those organisations that represent those particular individuals. So for me, it's about working with the healthcare professionals to get those messages across, but also raising the profile of genomic medicine and genetic testing as well, but raising and educating and getting those right messages right across the wider sector is very, very important.
Thanks, Manaza. And Tara, if we can come back to you with the same question.
Okay, thanks. I think, well, I guess you won't be surprised. I mean, I would certainly agree that education and information is important. I think that I suppose I often feel that less is more, and quite often getting the gist of things is enough, rather than. So, you know, I never thought patients came to me, for example, to get a lesson in molecular biology. And I guess the other thing alongside making information relevant and accessible goes alongside the education. And I think the other thing that can help is the active participation of patients and families and support groups, charities as well, so that those affected by, in this situation, genomic or genetic conditions, have a say in, for example, the decisions about the research that might affect them or the services that they're being offered. And the benefits of that, I certainly wouldn't underestimate the importance of you know, clinical skills and knowledge, for example, and academic expertise, but you get additional perspectives from including patients, families, and support groups. And I think it's also, you know, I don't use the phrase lived experience that frequently, I suppose, because I'm not sure I always grasped quite what it meant. But I think it's really about recognition that patients and families, you know, they're the experts in their own lives and living with their own conditions. So they've got a knowledge and understanding that others who have, you know, only heard about such experience do not have. And I think we can, capture the perspectives about the benefits and harms for patients that if you don't have their input, you just miss. So you think people are generally doing things to achieve the best outcome, but we can miss it if we don't know what the priorities for the patients and families are.
Absolutely, thank you. And obviously, as Vice Chair of our Patient and Public Voice panel, Mark, if I can ask you the same question.
Thanks, Barbara. I think patient advocacy is essential, yeah. And to get the patients to ask the questions, I think you've got to go to them with a soft approach, with a smile, yeah. And that effective communication is paramount. Yeah, healthcare professionals should communicate clearly and in plain language. Avoiding jargon and technical terms that patients and parents may not understand. Yeah, and so they should ensure that information is readily available without overloading them. One of my past experiences is going to a family who'd been diagnosed as having maturity onset diabetes of the young, and it was quite a large family in the northwest, and they knew that I was going with my syringes and vacutainers, yeah, ready to take blood from them. This was like kind of first thing on a Sunday morning, and it could have been devastating because some of the people there, out of I think there were 10 people, if I remember rightly, 10 people there. 6 of them rolled their sleeves up and were happy, and then there were at least 2 who were kind of just didn't want to have a needle stuck in them on a Sunday morning. Once we got going, and I gave them the talk about maturity onset diabetes in the young, and everyone was going, oh yeah, this happens to me, or this happened to Auntie Rita, who's now dead, yeah, and things like that, and they just came out and discussed everything, and then I think it was 2 weeks later. Because I think my attitude towards them and my openness towards them made them come back to me and say, "Look, we've got 2-3 more people to add to the family tree."
Gosh,
and so
yeah.
I think that kind of that is something that happened in the field, and and I've taken that approach, since that with with other families that I had to go and see, and I think it proved very helpful.
It's all about that active listening, isn't it? And
It is, yeah.
Because it just shows respect, doesn't it? But it allows for that better understanding of the individual, and the individual as part of that wider family.
Yeah, Barbara, I've never had a more concentrated pot of tea, yeah, Sunday morning, but it was a good experience.
Yeah, I bet. Before we bring this podcast to a close, I wanted to sort of come back to each of you in turn to share your vision of the future of genomic medicine in the UK. Mark, if we can come back to you.
Okay, the future, I think, holds great promise. I think genomic medicine is becoming and will become more integrated into routine clinical practice. And with genomic data used for more accurate diagnosis, personalised treatment plans, risk assessment for various health conditions, and enabling precise risk prediction for various diseases, and shift towards preventative healthcare, allowing for earlier diagnosis and intervention, as well as personalised prevention strategies. So genomic information will drive the development of more targeted therapies and drugs. This can lead to more effective treatments, with fewer side effects.
That's great, thank you. Manaza.
Thank you, Barbara. I feel that in terms of genomic medicine, so we're looking into the future. A lot of work's already been that's gone on in terms of mainstreaming, embedding genomic medicine into mainstream healthcare. So really, it's about data. It has to be data driven. Some work has already gone on in terms of driving that data, in particular with underserved communities. It's very, very important to have that data. To look at referring organizations and their data collection mechanisms so that we can better target precision medicine in terms of targeting those underserved communities. So one of the priorities will be really ramping up data in terms of our areas, whether it's in Northwest or right across the UK, to look at where the hotspots are in terms of the data and targeting those services which are much more than really focused on those underserved communities as well. So it's about data driven, it's about identifying the hotspots, but also making sure that those underserved communities have the awareness and the healthcare professionals are working with them and other healthcare professionals to make sure that we are equitable in terms of equity of access and making sure those communities come forward in terms of genetic testing, and also there is a really geared up campaign that is providing that information to those communities. So it's very, very connected. Thank you.
No, thank you, Manaza. And I think what you've said there really chimes with your comments earlier, Tara. If I can come to you with the final question, please.
Yeah, I don't know. I have much to add to what Manaza and Mark have just said. I mean, I think one thing is that the genetics and genomics community, and also patients and families, are either keen to or at least recognise the need for ongoing discussions that address specifically the ethical issues. So I don't, I certainly don't want it to seem like I'm here to pour cold water on the possibilities of equitable access or precision medicine. But I think, if we look back to some of the experiences, let me use that word, in the pandemic, for example, then healthcare ethics isn't new, pandemics aren't new, genetics and genomics is relatively new. I think one of the difficulties is that sometimes as individuals, certainly as organisations, we're not always good at recognising that there may not be new ethical issues through genomics or personalised medicine, but it may be that we're not always very good at dealing with the existing ethical issues. So it's still, I guess, for me, having that as part of a core to developing and delivering the services. So not it's not the only thing I'm interested in by any means, but I think it's got to be core to it. Otherwise, the opportunities that Mark and others have articulated may not be delivered to the widest possible group of the population or individuals in the populations that particularly need it.
That's great. Thank you very much, everybody. So we'll bring this podcast to a close, and a huge thank you to Mark, Tara and Manaza for joining me today.